Welcome to our channel. If you want to avoid unexpected medical bills, follow these step-by-step instructions to protect yourself from surprise charges. Step 1. Verify that all providers are in your insurance network before receiving care. This includes the facility, surgeon, anesthesiologist, radiologist, and any other specialists involved in your treatment. Step 2. Request a pre-authorization from your insurance company for planned procedures. This confirms coverage and helps you understand your financial responsibility in advance. Step 3. Ask for a detailed estimate of costs before any non-emergency service. Request an itemized breakdown showing what your insurance will cover and what you'll owe. Step 4. Choose in-network facilities for scheduled procedures and surgeries. Even if your surgeon is in-network, the hospital or surgical center must also be in-network to avoid surprise bills. Step 5. Understand the No Surprises Act protections. Since 2022, federal law protects you from most surprise bills for emergency services and certain situations at in-network facilities. Step 6. Review all medical bills carefully when they arrive. Check for errors, duplicate charges, or services you didn't receive, which are common billing mistakes. Step 7. Ask your hospital or provider about financial assistance programs before treatment. Many facilities offer charity care or discounts for uninsured or underinsured patients. Step 8. If you receive a surprise bill, contact your insurance company immediately. File a claim if the bill should have been covered, and use federal and state protections to dispute inappropriate charges. Don't forget to like this video and subscribe to our channel.